Hi, my name is Michael Illyrian, but most of my friends just call me Mikey. And then today I will be talking about a better healthcare consumer. And a couple of the references that I used for this actual video that I'm making right now is a history of healthcare reading, an American sickness article, and the modern U.S. healthcare video that I watched through Canvas. So going straight into it, so one major issue that is currently driving up healthcare costs for consumers in the US is a lack of price transparency, I feel like. Because unlike many other industries where the customers know the services before, like right up front, like before making a purchase, healthcare pricing is often unclear until after the treatment. And many patients actually receive unexpected medical bills with high charges for the different procedures, the tests, and the hospital stays. Because hospitals and providers are not required to disclose prices up front. It's kind of not like if you're going out and buying like a car or something. You actually don't know the prices until after the visit and after you get all your tests and everything ran. And I'm not the biggest fan of that, just because I feel like I would like to know what the actual prices are going to be for like me, like just going to the doctors and getting checked up on. But it's not you don't get that price right up front, and it kind of, for me, that's a really big issue. And then, like, even with insurance as well, patients often like face high deductibles, co-pays, and out-of-network charges that sometimes they just don't anticipate, really. And then another critical issue is the high cost of prescription drugs, and that's something I've noticed as well. Like, even when I'm like going out, if I don't have insurance, the drugs that I need, like to make sure my health is better, it's so expensive if you don't have insurance, and it's so scary. And the U.S. actually spends more on medication than most other developed nations because pharmaceutical companies can set their own prices, even without like regulating or negotiation. In contrast, like for like other countries have government systems that negotiate the different drug prices, which actually keeps the costs lower for consumers. And as a result, many Americans now are struggling to afford essential medications, and it's leading them to kind of ration doses or forego their treatment like altogether, which can lead to worse health outcomes, higher medical expenses in the long run. And then another thing that I've noticed as well is administrative costs significantly contribute to rising healthcare expenses. And the U.S. healthcare system is a very complex, intertwined like method or thing with multiple insurance providers, extensive paperwork, and complicated billing systems. And a lot of times hospitals and doctors, they need to employ like a huge administrative teams just to handle insurance claims and billing disputes, which drives up the overall cost of care itself. And then going further into it, and if I want to better protect myself as a healthcare consumer, there's a couple different aspects that I can do to make it a little easier for myself. And one way is to advocate for price transparency. Just ask them straight up, hey, what is my price going to be? And like through that, it helps the patients it helps them kind of make more informed choices based on what they want to do. And another thing that I could do as well is comparing different costs when I'm actually like trying to seek the treatment by researching the prices online, using cost estimator tools, and directly asking healthcare providers about the different expenses. And then another thing that could help me like a lot in the long run is actually understanding my own insurance plan. Still going through my parents' currently, but I will be having my own insurance plan here soon, and then I'm gonna make sure to review everything to make sure that everything that I have for myself is decently for me. Through understanding my insurance plan and reviewing coverage details, it kind of helps me know which providers are in network and asking about potential out-of-pocket costs as well before undergoing any procedures that I might end up having in the future. And another way as well is I can definitely stay informed about healthcare policies by following legislative changes, voting for representatives who support consumer-friendly healthcare reforms, and also advocating for policies that reduce cost and improve access. And through taking these steps, it will help me become a more informed consumer, as well as reduce unnecessary healthcare expenses that I might be faced with in the future. And yeah, this is what we talked about today and what I've read over the week about being a better healthcare consumer in the future and right now in my life. Thank you very much. This is the end of the video, and I look forward to learning more about this class. So thank you.